This is a really good question. How long does it take to build blood with herbs and fix blood stasis? Hey everyone, welcome back to the Chinese Medicine Podcast. Today I'm going to be answering comments from Instagram about Chinese medicine, and particularly I've got one question that was asked very recently about blood tonification. Ooh. When you want to find the comments, you can never find the comments. So I hope you're doing well, and I hope you're enjoying learning about Chinese medicine. So this is from Live Love Sahari or something like that. It sounds like you've merged something together there. I'm probably not pronouncing it properly. Hi Marie, how long does it take to build blood with herbs and to fix blood stasis? This is a really good question. How long does it take to build blood with herbs and fix blood stasis? I'm very much aware that people think sometimes, oh, Marie, you never get to the point in the video, so I want to get to the point in the video and then I'll give the explanation, rather than I'm not trying to string people along to get to the point. So really the answer is, if the blood deficiency and the blood stasis has been caused by like a one-off event that's no longer occurring, then it possibly could take 3 months to 6 months of treatment to rectify it. If it's been caused, now you wouldn't really have so much, you could have some blood stasis, but you wouldn't technically have much blood stasis if it was just caused by the environment, like cold damaging you. Then I've even seen some patients recover from that, well, maybe not recover completely, but have a significant improvement in their symptoms from taking the herbs for 2 weeks to maybe 4 weeks. And then usually after that, we're shifting to a different formula or reducing the dose down. I would normally encourage people, if it's a menstrual cycle related issue, you want to give your body at least 3 cycles to get that change happening. So for instance, if you've got a long cycle or an early cycle, or lots of blood clots in your menstrual cycle or pain, then you need to allow at least 3 cycles worth of treatment. So if your cycle takes 40 days, it might take that many, like 3 lots of 40 days. If your cycle's going for 25 days, you need to allow your body to have 3 cycles before you can sort of really judge what's happening. Now, sometimes changes happen straight away, and that's really good when they do, but they don't always do that, and that's more the normal thing. So to allow that amount of time. So if the blood deficiencies come from a surgery, or having a child or something like that, and the person's relatively young, so by that I mean let's say they're 30 or under, then there's significantly less time needed to treat it. So in Chinese medicine, and not all natural medicines have a similarity in this aspect, that the longer something's been there in your body, lingering around as a problem, the longer it's going to take to fix it. The more treatment it's going to take, or the longer period of time. Now, the treatment doesn't have to be just with herbs. It could start out with herbs, and then you could go into diet therapy, and then you could start to use a lower dose of herbs. So often what prohibits people from continuing on with Chinese herbs is the cost. They cost money. And I understand that, life is tough, and sometimes you have to cut the things that you think you don't need. Now, one of the problems that I see with my patients, and lots of people have this issue, is that sometimes people stop the treatment when it's working well, and they aren't able to really manage it when it comes back again well enough. So let me put it like this. In Chinese medicine, we don't think you have to take herbs forever. And I do want to answer this question. There's not an answer of 3 months, 6 months, 12 months, because it can really vary on what the cause of the blood deficiency is. So that's one thing, and the cause of the blood stasis. So if a person's had a blood deficiency and a blood stasis kind of issue, and they're in their 40s, or they're going into their 40, they're between sort of, let's say, 35 to 40, or then they're going from 40 to their 50s, then it's going to take significantly longer to treat it, and they might need to just stay on the herbs. And why would you stay on the herbs? Because you'll be feeling better. I wouldn't expect my patients to stay on the herbs if they weren't feeling better. So here's a couple of options that you can do in the treatment, in the course of the treatment. One thing is, you could take the course of the treatment always follow your practitioner's advice, but this is what I would do with my patients sometimes. So I might give them a couple of months worth of herbs, and they take those herbs, and then let's say the symptoms resolved, or they were better. We can talk about what the symptoms of blood deficiency and blood stagnation are, and how you would know if they're getting better. But for you would know, because you would maybe come to your practitioner with those symptoms, and then you would notice a difference, a significant improvement, hopefully, in those symptoms. So there's a few options. You could just stop taking the herbs and see what happens. If the symptoms all just flood back again, like within a couple of weeks, it's a good sign you need to stay on the herbs, that your body hasn't done anything significant to change the way that it can make blood. So that's what you're supposed to be doing. We're supposed to be rectifying the body's ability to function. Once a problem gets to a blood stasis problem, you no longer just have a functional problem. It's more of a what we call a material problem, like you've got an actual change that's taken place in your body, and it takes a long time to treat that. It can take years to kind of treat those things. And sometimes it's not possible with herbs to treat some kinds of stasis. Like in the Han Dynasty, they used Chinese herbs to break up masses, which we would now use surgery to get rid of those masses, to like remove those masses. I can't make any claims about treatments, what they can or can't do, timeframes of things, because of my restrictions in Australia. We have quite heavy restrictions on things that might be seen as making a claim. So what I'm doing here is I'm going to just explain how we would go about things and give you some of the timeframes from a theoretical perspective, but I don't want this to lead into something that could be perceived as a therapeutic claim, right? Like saying, oh, if you take the herbs for 3 months, the masses will reduce or something like that. No one really knows that. So what you want to do is come to your practitioner with the symptoms that you want to resolve, or the situation you want to resolve. Now, sometimes with blood deficiency or blood stasis, you might have you might want to get pregnant, and you might be able to get pregnant, and that means that you're probably less blood deficient than if you had a long period of time not being able to get pregnant. But then after the pregnancy, you might need to get on the herbs and stay on some herbs to really nourish your body, because you're more likely to be deficient at that time if you've come into the pregnancy being blood deficient. And then we have to think of the cause, like, is the cause still there, or has the cause gone away? So what are the causes of blood deficiency? You've probably seen this on many videos that I've done before. So things like bad sleep, poor sleep is a big one, a massive one. So if you went through a period of high stress, you were going through a divorce, or you were going through a moving house, or something tumultuous had happened, and losing your job, and that's kind of all over now, and your sleep was really bad then, but now it's not, well, that's a good sign that your body's probably got more ability of resource to heal itself than if your poor sleep was just kind of continuing on and it was still happening and still there. So that's one thing, right? If you have bad sleep, that's not a good indicator, predictor of being able to make blood. Secondly is your diet. So if you're continuing on to be a vegan or a vegetarian and you eat a lot of raw and cold foods, well, those aren't great predictors of staying healthy in terms of a blood deficiency pattern. Now, I know I'm going to offend all the vegans and the vegetarians out there, but that's just how it is. If you eat more warmer foods, then you might be able to mitigate some of those things, and you stay away from the cold and raw diet. That's one of the ways that you can mitigate against that. If you've got very heavy periods all the time, and that you have not been able to stop doing that. Now, if you're seeing a herbalist or an acupuncturist, that's something that they'd be working on stopping. That's something they'd be looking at treating, because it's like a sieve. It's like, it's just an empty sieve. The blood is kind of coming out, and your body's working really hard to make that blood, and then it just, like, too much of it's leaking out every month, and you're wasting that resource. So that's one of the issues if that's happening. So if you had very heavy periods and bleeding, and then that's sort of stopped, and the answer to this question depends on, one, how did you get blood deficient? If it's from taxation and lifestyle, it's going to take a lot longer. So maybe 6 months to a year of taking herbs, but maybe not at the same heaviest dosage that you were having the whole period of the time, but staying on committed to the treatment that in that time. You should be seeing a change in the symptoms as time goes on. You should be seeing things get better. And then secondly, if the cause of the problem was something functional, like it's a bleeding issue has happened and that bleeding's no longer happening, and particularly if before that situation you were otherwise healthy, I've seen people get quite good results from like 2 or 3 months of herbs. Like within the first 2 weeks to a month of the herbs, they should be significantly better. I've had a couple of patients like that. Like even recently, I can remember a few patients that I've had that stand out in my mind like that. So they'd had some kind of surgical issue happen and they'd lost a lot of blood, and then they'd taken herbs. That's when a practitioner's like taking their history to see were there any other issues sort of prior to this that would lead a practitioner to think that they're blood deficient. And in those cases, often the pulse will change quite dramatically, like it'd be very blood deficient, obviously when you prescribe the blood deficiency herbs, and then it may change much quicker than that. Now, the other thing to remember is that there are constitutional types that people have. And what that means is they're going to sort of lean towards that type in some way. So some people, they constitutionally tend to be more thinner and hence will be more drier. And some people tend to be more puffy and hence will be more fatter or more fluid retentive kind of people, more damp. So more damp or more dry, let's say, in a general sense, or more wet and more dry. Now, if you're in the dry category, you will tend to blood stasis and blood deficiency in a different way, just naturally, like over time, that's what will happen. Whereas the other type, the wet type, will tend to more sluggish and more dampness over time. Now, over a long period of time, that's going to damage your spleen chi, your tie-in aspect of your body. That will end up leading you to a blood deficiency anyway, because if your spleen and your center, your earth element gets a bit buggered up, it's not going to be able to transform and transport food and fluids properly, and you won't be able to make blood as easily. Whereas the dry person's going to sort of over time dry out, and there'll probably be a whole nother video about how those two things work. But either way, they can both end up leading to a blood deficiency. But what I'm getting at is sometimes constitutionally, people they tend to settle into a particular pattern that they'll have. And what that means is that they need to manage that with diet or lifestyle or herbs in some way. So what that means is usually you want to commit to the herbs for 3 months, maybe 6 months, depending on what your practitioner's kind of told you to do. And then at a certain point when the symptoms are less, your symptoms have gotten less, if money's a problem, then I would suggest to my patient that they could reduce the dosage if they want to, or we do that together. And you monitor it and you see. Now, if the symptoms surge all back up again, then you stay on the herbs, because the herbs are obviously needed at that dose. But if the symptoms don't surge back up again, what we're aiming to do is find like the minimum effective therapeutic dose. So we don't want you to take more herbs than you need to. I don't want you to waste your money. I don't want you to be overloading your body with things you don't need. But you also don't want to take too little herbs, especially when you're starting a formula. You won't know what it's doing. If it's doing nothing at all, you won't know if it's because that formula is not the right formula for you, or that just the dose is so little. So that's not a good way to start taking formulas. Like, I would never suggest that to patients unless there was some reason for us to think about that. There are some cases where people are very, very super sensitive to things in their digestion. If they have some kinds of Shaoyin patterns, they can sort of become like that. But we're not sort of talking about that. So I hope this video has been useful and helpful. I hope this has kind of helped to answer your question about blood stagnation and blood stasis, to how long it takes to build blood and to fix it, because we all want to fix things. And Chinese medicine practitioners of Chinese medicine should be operating from the fundamental principle that we don't want you to stay on herbs and acupuncture forever. Like, I want to discharge my patients. I want them to be free to support their body through diet and lifestyle. So sometimes people stay on herbs for a long period of time because they don't want to change their diet and lifestyle. They love drinking alcohol every day or every few days, and that in itself might be detrimental to a pattern that's happening in their body, but they don't want to stop doing it. So they will be like, well, I feel better if I take my herbs, so I'm not going to stop doing that. Or I don't want to stop eating my Twinkies and my delicious food that I love. Or I don't want to exercise. If they did those things more, they might be able to help themselves better. Now, some people love doing those things. They're really involved in helping themselves, and their body just still struggles. It's not a thing to say, well, that's not effective. It's possibly their situation might be heaps worse if they didn't engage in those activities that are helping them. But it's sometimes that thing has just been going on for so long that it's harder to treat. So I hope this has been an honest answer and a reliable one, like something you can understand. Thank you so much for your question. And If you're not a subscriber to the YouTube, make sure you click that subscribe bell down below. Make all my dreams come true. And I'd love you to check out my courses. I've just updated the course times for 2022. I'm starting the next sequence of my 1-year program, Ultimate Learning Experience with Marie Hopkinson. That's me. And you're learning self-care, self-help things about Chinese medicine in many different ways. So if you check out the link below, that'll take you to the courses. So I've got courses going from a year, 3-hour classes, with a little break in between. So it's about sort of 2.5 hours worth of training that you'll get from each session. I also have that broken down into shorter courses. So there's courses, there's a course that I've just finished recording called Self-Care with the Shang Han Lun. Very, very interesting. I'm super passionate about that because it's a different system of medicine, and it really, especially in the Tai Yang and the Yang Ming and the Xiao Yang phases, particularly that Tai Yang phase is where people just miss it completely. They don't even know that they're sick sometimes, and then next thing you know, they've got a sore throat. Well, this is a way of intervening with herbs, and also there's a lot of things you can do with foods to get those symptoms straight away before it turns into something more serious. So I hope that this is useful. I'll stop bangering on about things. But if you'd like to enroll in one of my courses, I would love to teach you in a deeper way, and you can do that. That's a way of supporting the channel. I don't have a Patreon or anything else like that. So you can support the channel by enrolling in a course, by supporting yourself and learning in a deeper way. There's heaps of stuff that I put in those courses that I would never put on YouTube and talk about on YouTube, because it's deeper content and it's more directed to teach you step by step how to be your own practitioner in the places where that's appropriate. So I look forward to seeing you again on another video soon. Thank you so much. Have a great day.